medical staff privileges were accepted by unanimous vote. The second session of the closed session was on March 10th. Public employee performance evaluation values items were discussed. Conference with legal counsel and legal issues were discussed.
Okay, I'm speaking closely now.
Oh, yeah.
Okay. Good morning. My name is Sue Burness, and I'm a member of the Weaverville community. I'm just curious, quick question. Are any of the board members a clinician?
No.
Okay. I'm a former clinician of 40 years. And I ask you, anybody in the room who's a former clinician, to take perspective. I come before you today to ask how you as a board can dismiss the serious complaints brought forth by the front line of those working in your hospital, those tasked with patient safety, the clinicians. I attended your February board meeting and listened to a recording of the March 4th meeting. Without any visual distractions, my ears clearly heard from the board president how your employees have been dismissed. What I heard loudly was, and I paraphrase, the hospital almost closed 20 years ago. Put your complaints in perspective. You should all be happy. You have a job while other rural hospitals are closing. Whoa. Not only dismissal, but shame. I read from the hospital's website, from the board of directors page. Guided by integrity and compassion, our board of directors is committed to ensuring accessible, high-quality health care for all residents of Trinity County. We support the Trinity Hospital's mission to deliver personal, reliable health care that reflects the spirit and strength of our mountain community. With respect, integrity and compassion appear to be lacking here. Financial responsibility is but one of your areas of oversight. Ensuring quality of care is another. You have clinicians crying out, yet you appear posed to sweep their serious concerns under the rug, rather than doing the necessary work to improve a broken system. At the end of the day, you may have money in the bank, but if you don't have clinicians, you have no hospital. Thank you.
Thank you.
Can you hear me? Dear board, my name is Bryson Gallagher. Coming up on a year in May, I've had the opportunity to work as an aide on med-surg and down in the ER. This opportunity only solidified my passion for healthcare, and for that I thank this hospital. While new to it still, I have built very meaningful connections with the nursing staff and every member that has an aspect within patient care. But from day one, I was warned of Patrick Shipsey, who has a reputation of being unapproachable and frankly not safe to work with. Firsthand, I've witnessed many newer nurses especially, but experienced ones as well, feel like they cannot approach him for fear of bullying and humiliation in front of not only their coworkers, but patients and patients' families. How do you expect to build a sense of trust, confidence, and collaboration between nursing staff and providers to give a desirable level of care to patients of Trinity County like that? This has been the culture from my first day in the department, and yet I've only seen the better side of him. This kind of discrepancy between levels of care on the floor has only built an increasing level of tension between nursing and providers, where newer nurses developing clinical judgment and decision-making often feel abandoned without resources on how to handle situations involving the care of patients, which places not only the patients in unsafe situations, but nurses at risk for their license. I'm currently going to school to pursue an education in healthcare, wanting to work as a registered nurse myself. And while grateful for what I've got to experience here and all that I've learned, I have zero desire to come back here and work after I'm done at school if the hospital is currently ran the same way it is now. It has been so utterly unprofessional at the administration level, it is appalling. It hurts my heart because I have so much love for every nurse and aide I've worked with, for providers like Heidi Johnson, Amber Flowers, and Dr. Smith. The firings over private social media posts just because the CEO, Aaron, and Patrick Shipsey don't see eye to eye with how Dr. Smith felt create an environment of fear to speak up or out against what is happening. Fearing for your job at the idea of speaking up on how to provide better patient care, and the total lack of leadership and communication to aid the staff that are with the patients 24/7 has caused such a tense work environment for the employees, enabling the idea of fear for their positions and their future here if they do not view the same way that our CEO or lead physician do. This is not appropriate in any industry at any level, but especially at the small rural hospital. This hospital is so important to this little community, and constant changing of nurses, providers being forcefully removed or fired, or leaving due to administration only provides a disservice towards the patients and residents of Trinity County. The disconnect between administration and floor staff has never been more apparent. The administration is constantly placing unfair strain onto nurses and aides that dedicate so much of themselves working unsafe hours under immense burnout, but a fear of retaliation. When we went through a month of low census on our med-surg floor, a rumor was floated about Patrick Shipsey getting talked to about not admitting patients. This resulted in Shipsey in a retaliatory manner starting to admit an unsafe volume of patients. This had the floor working with borderline illegal staffing ratios, which again had new grad nurses often working 24-hour shifts, sometimes multiple in a week, and pulling nurses off of orientation to work just to put them back on orientation the next week. I truly cannot emphasize how dire the improper staffing is, with issues arising seemingly every day, resulting in nurses having to find their own coverage to not be cornered into 24-hour shifts, and to give nurses proper orientation before risking their license. I don't see how any of this is okay. We found quickly that we did not have supplies for 15 patients, running out of the bare necessities like call lights, bedside tables, and IV tubing. When this occurred, little to no insight came from either Boleyn or Aaron. This was handled so poorly by the administration, in which I believe their absence on the floor only made it worse. I believe a more consistent nursing leadership presence on the floor would benefit the staff and administration to see firsthand what's going on, and to provide not just negative feedback. We were disregarded every time a concern was brought to Boleyn's attention and brushed off by Patrick Shipsey. As he said, it's not his problem how to manage staff, but he just admits patients. This lack of communication on how we were expected to shift our census levels and lack of accountability from administration placed immense stress and burnout onto the nursing staff providing care, as we were expected to figure out how to fit an additional 5 patients into limited rooms with limited supplies and no real way to ask for additional help or resources, all while expected to provide top patient care on top of that. My goal in speaking up is not to attack anyone individually, and quite frankly, I fear for my position here. If you can fire a doctor, I'm much more replaceable. But I believe in raising concerns that directly affect the level of care for the patients of Trinity County while trying to foster and create a healthier work environment for every employee. I'm asking the board to hold our CEO and CNO accountable to show active strides towards improving safe staffing, show open communication without fear for your position, and consider new personnel if no improvement is demonstrated. And for Dr. Shipsey to be held to the same standard every other provider and hospital staff is. It is unsafe for both patients and staff for his behavior to be tolerated as is. We all have patient care at the center of our hearts, but this culture is unacceptable and will continue to inhibit the level of care provided. Thank you.
Thank you.
So on that note, that kind of what my question is, oh, sorry, my name's Allison Smith. I'm a member of the community. What is being done about the staff complaints right now that have been already brought forth, that were brought, I was at the February meeting. I left very concerned about the situation with our hospital, more than I realized, and it continues in this meeting already, just after a couple of people have spoken, so I don't know if you can answer at this point, but what processes have taken place, and what can staff do if the internal processes fail? Because it'd be nice to not have to keep coming back asking what's going on. There's been a lot of letters delivered. People are speaking specifically here with the possibility of losing their jobs. That's serious. Have you been reaching out to the staff to investigate further? Can anybody speak for that?
So we're really not in a position to talk back at public session, but I will tell you that we are in fact having significant closed sessions, both personnel and legal issues that are in fact in front of us. And so that's where most of that activity is happening right now. And unfortunately, it does become closed session items because they are involving personnel and legal matters.
Right.
So that really kind of limits our ability to talk much about it. So. But we are in fact holding closed sessions because of that, so.
It would be great if, at the end of those sessions, as changes are implemented, this is thinking very positively, that you would make a public declaration through the newspaper, some way that we can read about what's been going on, what changes you're hoping to make the hospital a more inviting and safe place to work.
And my hope would be that we would be able to do that as well. So,
Yeah. Okay, thank you.
Hi, my name is Lisa Arnold. I'm from Hayfork.
I can't hear you, Lisa. Oh, talk right in.
Goodness. Can you hear me now? Oh, yeah. Ooh. Okay. I'm here today to share my personal experience with Dr. Shipsky and his leadership at Trinity Hospital. As a small community, we rely heavily on compassionate care, professional expertise, and high-quality medical service, as we do not have many other options for care. My father and I have visited this hospital multiple times and had various experiences with the care provided. While the nursing staff has demonstrated extremely good service, our experience with Dr. Shipsky has been not met with the same standard of quality. Over the past year, my father experienced significant illness, resulting in his hospitalization and care from Dr. Shipsky. One of these days, I briefly left the hospital to grab some items for him. When I returned, Dr. Shipsky saw me walking in and said, "Hey, I want to talk to you about room 105. In the situation that we're in, that just totally blew my mind. You mean my father? I mean, he's not a number. In reference to my father's room, this gave the impression that there is lack of bedside manner, and that the patients are seen more as numbers than individuals. Dr. Shipsky informed me that he had a private conversation with my father. Gosh darn. Had a private conversation with my father in my absence, and stated that all antibiotics and fluids had been discontinued because my father was ready to die, advising me to prepare myself. He also had my father sign papers to cease all treatment aimed at recovery. When I went in to visit with my father afterward, of course I went in, because what if that's what my father wants? So I have to go in with no tears, no nothing, and be like, "Dad, is this what you want?" I have to give him comfort. That's what he's really desiring. Turns out this is not what my father's desire was. where was I? That he'd signed papers. Okay. When I visited my father afterward, he was confused from the infection and shared his understanding of the visit of the conversation with Dr. Shipsey. My father believed that his cancer had compromised his kidneys and was shutting down his body, leading him to think that he no longer wanted to fight the cancer. Since I was not present at the time of the conversation, I was unable to help my 85-year-old father understand the conversation the medical staff at the hospital was having with him. I contacted his doctors at the cancer specialist to obtain the information regarding the cancer shutting down his kidneys. They were able to clarify that the cancer information regarding, I contacted to obtain the information regarding the cancer shut down his kidneys. They were able to clarify that the cancer was not shutting down his kidneys. Instead, his kidney function decline was a side effect of the infection he was being treated for under Dr. Shipsey's care, and they were expected to rebound. I feel that if Dr. Shipsey had taken the time to fully understand my father's case, he would have recognized that my father was being treated. Oh my goodness. I feel that if Dr. Shipsey was, hold on, my eyes are bad.
You just hold it up close to your eyes.
Yeah, because I'm having a hard time. I'm trying to talk in this microphone. I just have a hard time. I feel like Dr. Shipsey had taken the time to fully understand my father's case, he would have recognized that my father was being treated as an individual, not merely a case number. The bedside manner displayed was inadequate, especially considering my father's impaired mental state. And as his medical power of attorney, I believe I should have been present for the medical decision. An apparent lack of professionalism and empathy in the situation is concerning. If I had not been there to advocate for my father's needs to resume antibiotics and fluids, he might not be alive today. Such treatment decisions, especially during vulnerable times, should be handled with clarity and compassion to avoid confusion and additional stress to patients already facing serious health challenges. My personal experience was not any better. When I was admitted to the hospital following my back surgery, my experience was less than satisfactory. After the procedure, I was transferred to Trinity Hospital. Actually, after the procedure, when I was at the hospital, they gave me a list of places I could go for recovery. Trinity Hospital was not even on the list. I went to one that was in Reading, found out that I could come to Trinity, had to find my own way to get here so that I could be admitted here because I wanted my dad not to travel all the way to Reading. So hopefully you guys are put on that list. At the procedure, I was transferred to Trinity Hospital to complete my recovery and be closer to home. Dr. Shipsey informed me. So when I got to Dr. Shipsey, the other facility had me on a lot of pain meds, and I don't like that. Of course, I don't like being in pain either, but I didn't want to be so on so much that I was incoherent. I can't function like that. So I asked him if we could do lower doses, see how it works out. Sure, he said. So he put me on a lower dose medication, and he told me if I required additional pain management overnight, the nurses could simply knock on his door and request a prescription for additional pain medication. However, when I requested this, the nurses were hesitant to wake up Dr. Shipsey due to their fear of disturbing him. As a result, I had to attempt to get up myself because I was angry, I was in massive pain, and I was like, what door is his? Because I will go knock on it right now. That's when the nurses, they went and they got him, got me all taken care of, get the necessary prescription to manage my pain. Aside from these two distressing experiences, the level of professionalism within his leadership highly concerned. He has brought his dog into the hospital despite the dog not wearing a service animal vest allows it to run freely. I'm told that if I don't want the dog in my room, to close my door all the way. When you're already sitting in there, I don't want to be, it's like being in a cell. You're already miserable, you're laying in there, and now you've got to close your door and close yourself off from the rest of the world so this dog doesn't come running in. Anyway. It's just, I just could go on, and I'm not trying not to do that, but apparently I'm not in control. An additional example of unprofessional behavior Dr. Shipsey occurred when he asked if I had any questions during one of my appointments when I asked, it's like a care conference. I got a room full of people, more than you guys, and him, and me, and then I had my friend, she's like family, but she's in Phoenix on the phone, so she can ask questions, I can ask questions. So I asked a question about, I can't remember exactly what the question was, but I do remember being told I was stupid. In a room full of people and nobody said nothing, they all just sat there quiet. My friend wasn't so quiet. This behavior reflects on a lack of bedside manner as well as a lack of respect and compassion towards his patients. Our community needs compassionate professional medical care. The way our local doctors and nurses, practitioners are, Dr. Shipsey shows a pattern of inconsistency dating back to the early 2000s between his actions of slaughtering animals during the land dispute, opioid misuse, and clashing with his staff. I am concerned that his behavior has not changed. While I sincerely hope that these are not representatives of other patients' experience, I do not believe I am alone in this encounters with Dr. Shipsey. I trust that the board will take these concerns seriously and work to improve the quality and care provided to the members of our community. Thank you.
Thank you.
They're up there. You can walk up and hand it to them. Good job.
Anybody else?
Get myself organized. I was, but now I'm not.
That feels familiar.
I just feel really organized. Hello, board. I like your agenda because it seems to be responding to the lack of how well you guys are doing. May I have your name, please? Yeah, sure. Wendy Armagnac. Thank you. And I'm not a member of your community because in all transparency, I moved to Reading a few months ago. But I still come here for medical care, and I also have seen, as I shared with you in the February meeting, so much change without explanation. I also, hearing the name of Dr. Shipsey is not a surprise to anybody in this room. And I think everybody's waiting for some kind of action. And again, I applaud you for your public relations angle on this survey. Good timing, good packet. If any of you missed that, you should check it out.
Where was that available?
Huh?
Where was that
In the
available?
agenda,
Oh.
I guess they didn't expect so many people.
The packet's available at administration, and that's noted on the agenda. So our public packet, you can make a request between certain hours to obtain that.
Okay, I requested to be on the agenda, and I did not talk about wanting to address or expect response regarding personnel issues. I had asked to talk about what the next steps that the hospital board is responsible for. And was very politely called by Mr. Porcelain. Did I say that right? Okay. Would you hold my phone for me? Anyway, so I received no notice except Mr. Porcelain called me, and I was very pleased with that. I have a presentation about what the next step should be according to the research I did what you guys owe the public, and you do, even with personnel issues, there's a way to respond to public concerns. How you decide to do that is something you should talk to your lawyer about. But there are posted next steps available for these kinds of concerns. And this is I timed it, it's 5 minutes, so if somebody wants to give up their 3 minutes, I'd appreciate it.
You're fine.
Yeah, Daryl said, I won't stop you. I said, good idea, don't stop me. Anyway, it's been a considerable amount of time putting this together. Like I said, it's a compilation of different resource sites and research pages. And there are specific steps that you have a responsibility to take. And that also includes responding to the public, especially when the same name keeps coming up and your CEO is called into question publicly as well as privately. Even though I moved to Reading, I spent years getting people coming to me, giving me documentation. I don't know why. You know, I'm like that person where, I like you, stranger, I'll share everything with you. So I've had a lot of discussions over the years with practices here. There is a board accountability and response window. Following public and written employee complaints, a hospital district board is expected to acknowledge the concerns formally, typically in an open session or through a published statement. Place the issue on the future board agenda for public discussion or closed session. It appears you have put that on the closed session. Initiate an internal or independent review if the concerns involve workplace misconduct, safety, or retaliation. I would suggest that you open up to an independent review. You obviously have people who are aligned with each other, and there's somewhat of a triumphant, and they're not going to let the change occur. And that's something you, as the leader, the CEO, should be interested in learning about, okay? I question your managerial techniques. Direct the CEO or HR or chief medical officer to handle complaints and report back on corrective actions. The fact that 6 weeks have passed with no communications raising governance or compliance concerns, given that these meetings are held under the Brown Act, it requires transparency and timely public business handling. Something should have come from this board at this point. Legal and regulatory expectations, you run under the Brown Act, so the district board must conduct business publicly, which you do, but there's been no follow-up on the concerns. And I really appreciate all the people who have been showing up. I had shoulder surgery, so I wasn't here last month, but I had a recording sent to me and a video. Failure to address an issue repeatedly raised in public meetings without explanation can constitute noncompliance or negligence in governance duties. The board is required to include the item on an agenda, report actions taken in closed session, and how you do that legally is something you need to investigate. 121, a district board has the duty to ensure effective administration of the hospital. In my opinion, that is an evaluation of your CEO and your CFO. You're up 11% this year, which for rural hospitals is truly golden. But telling somebody that they're lucky to work somewhere is right out of 1942. So Daryl's going, I would disagree with that.
Well, I don't disagree with that, I just don't see where I said those words. So, I mean, I certainly said that we're doing better, but I certainly don't think, if I said that, I didn't intend to say it.
Well, I'm glad.
Sorry.
I'm glad. Thank you. I appreciate that. But if you're up 11%, that makes me think that your CFO's a killer. Good job. I don't know if you're responsible for that 11%. If you're nervous about letting someone go because you are up 11%, that is the bottom line acting versus community and patient health. All right. I'm waiting for that corrective action. And again, I've been a patient of this hospital. Dr. Harwood has done wonderful things for me. Many people who have worked here have done wonderful things for me. I know you don't fire people, you just don't put them on the schedule. That's how you fire people. That is the most passive-aggressive management tool I've ever heard of. Wow. You're gonna run something, you have to have the wherewithal to look at someone, talk to them, figure out a mediation, and then go forward. That would be like me going back to teaching school and having my door locked and with a different key. That's bad management. Okay, you have to maintain compliance with state and federal law and healthcare workplace safety laws, OSHA, EEOC, etc. Inaction in the face of documented staff and community concerns, especially if it's tied to patient, I'm getting dry mouth here, especially tied to patient care risk. This can lead to breaches of fiduciary duty and regulatory exposure. I'm getting some water because I'm talking so much. Girls talk. Okay, thank you. Okay, personnel and workplace safety regulations. If employee letters raise allegations such as harassment, retaliation, and unsafe working environment, both California Labor Code 6400, including Cal OSHA, and Title 22, health and safety regulations for hospitals may trigger, I will give you all a copy of this, by the way, a requirement for an internal HR investigation, reporting to OSHA or the California Department of Public Health, and if continued in conditions endanger staff or patients. Mental, by the way, mental toxic work environments that impacts patients. Legal risk for the district if retaliation or silence continues in constructive dismissal or unsafe care. Practical steps if the board remains silent. Submit a written request, anybody can do this, California Public Courts Government Code 6250, asking for any board or administrative correspondence, minutes, actions taken since the first meeting concerning these items and persons. Whether any investigation was initiated, escalate to oversight authorities. Trinity County, now I've read the Trinity County Grand Jury for 20 years, so this can go to the Trinity County Civil Grand Jury, which routinely investigates local government transparency, as has it's previously done with MCHD Trinity County. Happened before. California Department of Healthcare Access and Information, HCAI, they can request many things from you. And CDPH licensing and certificate for potential governance or patient safety concerns. If retaliation happens, your staff can get it through to OSHA whistleblower. You know, are you and I related?
I think so.
Oh my gosh, look at me. OSHA whistleblower unit, State Attorney General's Office, which is Public Rights Division, California Board of Registered Nursing or Medical Staff, if physician conduct is involved. And there have been similar local incidents as proven by the public outcry that governance breakdown following management decisions tied to culture and physician conflict has been proven. Anecdotal or not, it's coming at you, even though in your agenda you have done a nice statistical approval of 100% happiness. It's in direct conflict with what you're hearing. In early 2026, staff and community members packed board meetings over the removal of ER physician Dr. Chad Smith, revealing widespread concerns about toxic culture and poor management transparency. The Rancheria got him anyway. Just as I said to you guys before, everybody goes to the Rancheria. Now, summary of legal duties now in play. Apparently there is lawsuit concern. What is the next required action from the board? fiduciary duty to protect district integrity, ensure response to verified workplace issues, acknowledge and investigate complaints, report the progress publicly, investigate your hospital CEO and management. Whoever was up here who said if you don't have staff, don't have a happy working environment, and I know that's all la la la. If you don't have that, you don't have a hospital. Because we know the finances are, the 11% is coming off of the workers' backs right now. Duty to maintain safe workplace, comply with Title 22 and OSHA, initiate internal exams. The biggest thing is your corrective plan. Do you guys have a corrective plan in place? Medical staff leadership, maintain physician professionalism under hospital bylaws, address behavior of physician in question, document outcomes. Okay, I think I've said everything, the right to transparency and safe service. I'll give you this so you know who you're liable to. Because you're liable to a lot of people. And I don't think anybody sitting on this board is interested in having things go south intentionally. And I don't think anybody in this board doesn't care deeply for this hospital. I actually love this hospital. I've been in this hospital with a heart attack. But I was advised to go to Reading, which is very sad. So that's the end of my report. Thank you for listening to me, even though my mouth got dry. And Daryl, thank you for smiling. I appreciate that. And if I have a agenda request for next month, I'll make sure it doesn't mention personnel. I'm gonna make sure it mentions where are we now. All right, thank you very much. I appreciate it.
Thank you.
Please honor with them. Something else that I forgot to tell you about when I was up here being nervous. Another thing that was concerning when we were talking about the dog. So my dad's there with an infection. We've got this dog just running freely, coming in the room. When I'm laying in bed sick and a dog comes in, I am a dog lover. Love them dogs. You want to pet them, you want to feed them, you want to give them some snacks. They're so cute and you feel good. Not this dog. I was in the hospital and the dog comes in. Shipsy's in the room with me and my father, and I just went to go pet the dog and was told by Shipsy, don't feed my dog. Like, and even my dad was like, what the hell? You didn't have food in your hand. I just want to share that part. Thank you.
Anybody else?
Thank you for your attention, and I just want to say that all of us want the hospital to succeed. We are fortunate to have a hospital in our rural community. This would not fly in a big city.
Especially the
I guess I would like to respond a little bit that the comment that I made about the fact that the hospital is doing well was that in fact we had the opportunity to have these kind of discussions rather than discussions about the hospital closing. So if I got misinterpreted, I apologize, but my goal there was there is good news at the hospital, and that it is fiscally strong. And that does give us the opportunity to have these kind of discussions. So
Right.
I apologize for misinterpreting if in fact that was my goal, to talk about that relative to the fact that it's good news, but it does give us the opportunity now to talk about what we're doing from the standpoint of the patient care levels.
It's good to hear you say that today, because in the past, it has really seemed like major blinders have been on.
I guess the other point I wanted to make is, and I really believe this too, everybody in this room cares about this hospital.
We do, and I really appreciate the information that was just provided to you, because that's to help the board and the administration be successful. No one wants to report us to the California Department of Health. But if we don't see some serious action soon, some transparency to the public, I fear that that may happen. Thank you.
Thank you. Anybody else? We'll get on to reports. Medical